Today, I'm honored to speak with Miss Jacky, a young but highly experienced nurse who has been working in the emergency department of the public 12 de Mayo Hospital for over 7 years. And Jacky studied nursing at the University of Science and Humanities and has specialized in emergency and trauma care and treating thousands of patients in critical condition with a calm and professional approach. And her experience provides valuable insight into the challenges of working in public emergency services. Definitely an as inspiring story that deserves to be told. Let's start with the first question. How did you decide on your current profession, Jackie?
It's a decision that was shaped by both personal experiences and a strong sense of purpose. Since my mother is a retired nurse, I was able to see the pros and cons of her profession during my childhood and adolescence. Although she had an exhausting daily routine, she always had a big smile when talking about her anecdotes or experiences at the hospital, which made me admire her even more. Her life story inspired me deeply. Later on, I decided to study nursing because I wanted to be that kind of support for others. During my training, I discovered that I had a natural ability to stay calm in high pressure situations, which led me to specialize in emergency care.
Definitely a great role model. Tell us, what were the biggest challenges you faced at the beginning of your career, and how did you overcome them?
At the beginning of my career, I struggled with time management and emotional resilience. The emergency department is extremely fast paced, and as a new nurse, I find it overwhelming to keep up with the urgency of each case. I also experienced self doubt, questioning whether I made the right decision in choosing this career. Another challenge was dealing with the emotional weight of witnessing trauma and death for the first time. To overcome these challenges, fortunately, I had wonderful senior nurses who guided me. I also attended extracurricular workshops to improve my skills. Over time, I gained confidence and developed greater emotional strength.
Could you describe what a typical day in the emergency department looks like for you?
Every day in the emergency department is unpredictable. I usually begin by receiving a handover from the outgoing shift and quickly assessing any critical patients. After that, I assist with triage, evaluating new arrivals and determining the urgency of their conditions. Throughout the day, I monitor vital signs, administer medications, and manage a wide range of cases, from minor injuries such as fractures and burns to life threatening conditions like severe infections, strokes, cardiac arrests, and trauma from accidents. By the end of the shift, I am physically and mentally exhausted, but I always feel that I've made a meaningful difference.
That's so interesting. And having said that, what part of your profession do you find most challenging?
One of the hardest aspects is dealing with the emotional toll of certain cases, especially when young lives are lost, which reminds me how fragile human beings are. It never becomes easy, even after many years. Another challenge is the lack of resources in the public sector. Sometimes we are forced to work without enough equipment or staff we truly need. It's frustrating when you know what a patient needs but can't provide it right away. Despite those obstacles, we do our best with what we have. I believe that with better funding and planning, hospitals can offer care that is just good as private institutions. I hope to see those changes soon.
It's clear that people have faced challenges in recent years. How has your role changed over the years, especially with recent recent global health events?
My role has changed significantly, particularly after the COVID-19 pandemic. During that critical period, we have to adapt quickly to new protocols, including infection control and patient isolation, while also trying to stay safe ourselves.
Mhm.
Many of us became ill, and sadly, some colleagues passed away, but we continue our work. Nurses were on the front lines, managing not only physical care but also providing emotional support, since families were not allowed to visit their loved ones. Since then, our responsibilities have expanded. We are now more involved in community education and vaccination programs. I've had to continuously update my skills, and I believe my role has become more multidisciplinary and essential than ever before.
And what motivates you to keep working in such a high pressure environment after all this year?
The biggest motivation for me is the impact I can have on a person's life during their most vulnerable moments. Knowing that I helped stabilize someone or comforted a frightening patient or gave a family hope gives me a deep sense of fulfillment. There's always something new to learn, and I continue to feel challenged, which keeps the job engaging. Lastly, I'm proud to serve in the public sector because I believe everyone deserves access to quality care, regardless of their background or circumstances.
If you could change one thing in the public healthcare system, what would it be?
If I had the power to change one thing, I would improve the funding and distribution of resources within the public health sector. There is a critical need for more medical staff, updated equipment, and consistent access to essential medications. Too often, the system becomes overwhelmed, and patients experience delays that could have been prevented with better infrastructure and planning. I remember doing my rotations in Ayacucho, where the conditions in the hospital were truly disheartening. Unfortunately, the situation in provincial hospitals is often even worse than in Lima. This disparity highlights the urgent need for equitable investment in healthcare across all regions of our country. Strengthening the system, especially in underserved areas, would lead to better patient outcomes and reduce long term pressure on centralized emergency services.
Looking into the future, how do you see the role of emergency nurses evolving?
I see emergency nurses becoming more autonomous and playing an even more central role in patient care. As healthcare systems become more complex, I believe we will be entrusted with greater responsibilities, perhaps initiating treatment protocols or managing minor cases independently. Technology will also be a key factor. Nurses will need to be trained in using digital tools. Our role is evolving from just caregivers to critical decision makers, educators, and leaders in crisis situations.
It is inspiring to hear about your life so far. And what are your future goals or aspirations in this profession?
I'm currently exploring opportunities to pursue a master's degree in emergency and critical care nursing abroad. with the intention of returning to my country to apply the knowledge and skills I've gained. In the future, I hope to take on a leadership role within the hospital, perhaps as a coordinator or clinical educator. I'm passionate about training the next generation of nurses and sharing the insights I've acquired through hands on experience. I also believe there is significant potential to improve public health at the grassroots levels, particularly through education and community engagement. My long term goal is to continue making a meaningful impact, both inside and outside the hospital.
Thank you so much for your time, Jackie. Is there a final message you would like to share with someone who wants to follow a similar path?
Thank you, Stephanie, for inviting me and for the opportunity to share my experience with your audience. To anyone who wants to follow a similar path in healthcare, especially in emergency care, I would say work hard, but also be prepared for the reality of this profession. This path is incredibly rewarding, but it demands resilience, empathy, and a deep commitment to others. When I was studying at university, I sometimes doubted my decision and even considered quitting. But today, I can confidently say that this career is for brave people. You will face difficult days, but you will also witness powerful moments of hope and human connection that will stay with you forever. Looking ahead, healthcare will continue to evolve, and so must we, both as professionals as people. Keep learning and always remember why you chose this path. If you truly care about making a difference, this profession will give you purpose every single day. Thank you.